As a pediatrician volunteering in Haiti since 1988, I saw children in a village clinic, some of whom had never seen a doctor before. Many of the problems and diseases I was seeing didn't even exist in the U.S. For example, anthrax, leishmaniasis, and malaria. Other children were seriously ill, more often than expected because their immune systems were depressed due to malnutrition. They were too weak to fight off diseases that well-nourished children could easily beat. 1 in 10 children in Haiti is acutely malnourished, 1 in 5 is underweight, 1 in 14 children will not live to see their 5th birthday. Giving antibiotics over and over was not the answer to the underlying problem. In order to truly help these children, I knew something had to be done to nourish them from the beginning, to prevent these problems from taking hold in the first place. In the early 2000s, a colleague of mine, Dr. Mark Maneri, was doing some of the first research studies in Malawi on ready-to-use therapeutic food, which we refer to as RUTF. RUTF was such a simple idea, a peanut butter-like food product, a mixture of peanuts, sugar, milk powder, oil, vitamins, and minerals that provided all of the nutrients a child needed, but it just hadn't been thought of before. RUTF revolutionized the treatment of childhood malnutrition. Not only were cure rates 85% compared to 25% before, but also this treatment didn't require hospitalization. Parents could treat their children at home and not lose the opportunity to continue to work and care for their other children. A weekly visit to the malnutrition clinic was all that was needed for 6 to 8 weeks until the child was completely rehabilitated. I brought the recipe to Haiti and began producing it with a hand grinder in a church schoolroom. 8 years ago, we made 100 kilograms a month of Medicamamba. Now we can make 10,000 kilograms a month. In our new factory, we'll be able to make 30,000 kilograms a month. But treating malnutrition isn't enough either. Nutritional rescue is important, but it only leads to more rescues. That's why Medicine Food for Kids has continued to produce its RUTF, Medicamamba, in Haiti, although it would be less expensive to make it in the U.S. and ship it to Haiti. MFK trains and employs local people in our factory. We mentor subsistence peanut farmers in better methods with greater outputs and greater quality. And we initiate new malnutrition programs all over Haiti, and we do research on new products for other vulnerable populations in Haiti. If farmers produce peanuts unaffected by the fungus that permeates peanuts all over Haiti, MFK buys those peanuts, putting money in the pockets of local farmers. Currently, MFK operates out of a modified rental house in Cap-Haïtien, Haiti. Our production equipment is on the first floor of this house. We have the production capacity to treat about 8,000 children a year, but the need is so much greater than this. MFK is currently building a new, larger factory in Cap-Haïtien that will allow us to treat over 80,000 children a year. With that level of capacity, within a few years, there will be very little severe malnutrition in Haiti, and we'll be able to provide preventative and supplemental products to offer to other nutritionally vulnerable people, like pregnant and lactating women, school-age children, and patients living with HIV and AIDS. MFK is unique because we're social entrepreneurs. We're not just providing food aid to children and families that need it. We're also investing in the local economy by providing jobs and training for Haitian employees. Another leverage point is that part of our mission is agricultural development. We have a full-time agronomy staff that works with farmer co-ops to increase peanut yields and reduce mold and toxin growth on crops. We partner with local peanut farmers and buy their peanuts. Right now, we lose money doing this because it would be so much easier to produce in the U.S. and export the product or purchase all of our peanuts from the U.S. But development is a long-term project. It takes a lot of work and a lot of persistence to work in partnership with the Haitian people to build a safe food production facility meeting all international standards. We want to be an inspiration to others for what can be done in Haiti with perseverance, hard work, and commitment. Haiti needs healthy people who aren't impaired by malnutrition in infancy, and they need the tools to be self-sufficient. We are seeking donations to help us build the new factory that will be self-sustaining in 2 years. Our on-the-ground presence for a long time in Haiti, of both Haitians and Americans, and our acquired ability to maneuver in the country and culture are key to our success. MFK is effective because we're very efficient with donated money. We're connected to several universities who have volunteered their consultation pro bono. We've maximized our mentoring possibilities in Haiti by using recent college graduates on poorly paid fellowships, and we're continuing to engage corporations and construction companies in providing pro bono services to MFK and to Haiti. The real measurement of success is how many children's lives we've been able to save each year. We also like to look at how many farmers we've partnered with and how many kilograms of high-quality peanuts we've been able to buy locally. How many Haitian people have we trained? How many Haitian people do we employ? Our measurements of success at the end of the day are always about people and the lives we've been able to impact. Because of our name, I think people think of us as more medical than we are. Our name comes from the antibiotics and the anti-parasite medicine that we give to children enrolled in the malnutrition programs. It turns out, though, that the treatment of childhood malnutrition is the simplest thing we do. Our production and agricultural activities are much more challenging. We have countless success stories of the children whose lives and intellectual ability have been saved with Metacomamba. Organizationally, we have other accomplishments that we're proud of as well. We introduced RUTF treatment to Haiti and worked with the Ministry of Health to add RUTF to the Haitian national protocols for the treatment of malnutrition. We started a dialogue in the country regarding food safety. Both the World Bank and the Inter-American Development Bank have recognized us internationally for our innovative and effective model of economic development. Doctors Without Borders recently audited our production facility for compliance with stringent international standards, and we passed. We are the only entity in Haiti to ever have passed such an audit. Producing Metacomamba in Haiti is expensive. It's challenging to operate a business in Haiti. We're always trying to prove to large international NGOs that buying life-saving products from us is worth the small premium. We must always prove that the jobs we create, the farmland we help develop, and the money we keep in Haiti is worth it. It takes a long time to see results, but this will be lasting change. We've weathered fires, car accidents, stolen water pumps, employee sicknesses, hurricanes, and earthquakes. We know how to cope and problem solve. We would use additional resources to finish our factory and add new production equipment to vary the nutritional products we're able to manufacture and distribute in Haiti. We would also add social messaging, such as radio, billboard, and cell phone messages, to our current malnutrition prevention project in a slum in Cap-Haïtien, endeavoring to provide reinforcement of educational nutritional messages. We would also buy a truck to transport our products to customers across Haiti. One gap that MFK wants to fill is to do more work in product research and development. We want to make products using locally sourced ingredients that we would fortify and make available for improving the health of several different vulnerable populations. Another is the need for local capacity in inventory control and logistics. And finally, we would like to expand our agricultural programs.